Hello and welcome. Today we're diving into the world of respiratory health to understand a condition called hemothorax. Hemothorax, in its simplest form, is the accumulation of blood in the space between your lung and chest wall, the pleural space. This can be a serious condition requiring prompt medical attention. Join us as we explore the causes, symptoms, and management of hemothorax. So, what causes blood to leak into the pleural space? The etiology of hemothorax is quite varied. Trauma is the most common cause. This could be from a blunt force injury like a car accident, a fall, or a penetrating injury like a gunshot or stabbing. Other causes include surgical complications, such as after a lung biopsy or cardiac surgery, bleeding disorders like hemophilia, certain lung diseases like lung cancer or pneumonia that erode blood vessels, and rarely, spontaneous hemothorax, which can occur without any obvious cause, often linked to underlying conditions such as blood vessel abnormalities. Now, let's discuss the pathophysiology, or how hemothorax affects the body. The presence of blood in the pleural space disrupts normal lung function. The accumulating blood takes up space, compressing the lung and making it difficult to expand fully during breathing. This compression leads to reduced oxygen intake and increased carbon dioxide levels in the blood. Furthermore, the blood can clot within the pleural space, creating a thickened, fibrous layer that further restricts lung movement. In severe cases, this restriction can lead to respiratory failure and other complications. Regarding epidemiology, hemothorax is most commonly seen in individuals who have experienced chest trauma. Therefore, young adults and those involved in high-risk activities are often more susceptible. The incidence varies depending on the population studied and the prevalence of traumatic injuries. While precise global figures are difficult to obtain, understanding the common causes within a specific region can help guide preventative measures and improve clinical management. The signs and symptoms of hemothorax can vary depending on the amount of blood in the pleural space and the underlying cause. Common symptoms include chest pain, which can be sharp and worsen with breathing. Shortness of breath is another prevalent symptom, resulting from the lung compression. Patients may also experience rapid breathing, known as tachypnea, a rapid heart rate, also known as tachycardia, and in some cases, a bluish discoloration of the skin, known as cyanosis, indicating low oxygen levels. If significant blood loss has occurred, symptoms of shock, such as dizziness, lightheadedness, and loss of consciousness, may also be present. Diagnosing hemothorax typically involves a combination of physical examination and imaging studies. A doctor will listen to your lungs for decreased or absent breath sounds on the affected side. A chest X-ray is usually the first-line imaging test to confirm the presence of fluid in the pleural space. A CT scan of the chest provides more detailed images and can help identify the source of the bleeding or any associated injuries. In some cases, a thoracentesis, a procedure where a needle is inserted into the pleural space to withdraw fluid, may be performed. This allows for analysis of the fluid to confirm the presence of blood and rule out other conditions. While hemothorax isn't strictly classified into distinct types, it can be categorized based on the size of the hemothorax, such as small, moderate, or large, or based on its chronicity, either acute or chronic. The underlying also plays a significant role in how the condition is categorized and managed. Understanding these factors helps tailor the treatment approach to each individual patient. Treatment for hemothorax focuses on stopping the bleeding, removing the accumulated blood from the pleural space, and restoring normal lung function. The initial steps often involve stabilizing the patient, which includes providing oxygen and administering intravenous fluids. A chest tube is typically inserted to drain the blood from the pleural space. In cases of ongoing bleeding or significant blood loss, a blood transfusion may be necessary. If the bleeding is severe or doesn't stop with conservative measures, surgery, such as video-assisted thoracoscopic surgery or open thoracotomy, may be required to identify and repair the source of the bleeding. Physical therapy and respiratory exercises are also often recommended to help restore lung function after the acute phase. Preventing hemothorax largely depends on the underlying cause. Minimizing the risk of trauma, such as wearing seatbelts in cars and taking precautions during high-risk activities, is crucial. For patients undergoing chest surgery, careful surgical technique and post-operative monitoring can help reduce the risk of hemothorax. Managing underlying medical conditions that can contribute to hemothorax, such as bleeding disorders, is also important. The prognosis for hemothorax depends on several factors, including the cause, the amount of blood in the pleural space, and the patient's overall health. With prompt diagnosis and appropriate treatment, most patients recover well. However, complications such as empyema, which is an infection in the pleural space, or fibrothorax, which is a thickening and scarring of the pleura, can occur, potentially leading to long-term respiratory problems. Recent research is focusing on improving techniques for minimally invasive surgery to reduce the risk of complications and improve patient outcomes. Furthermore, studies are exploring new methods for preventing clot formation in the pleural space to minimize long-term lung damage. Thank you for joining us today to learn more about hemothorax. Remember, early detection and treatment are crucial for the best possible outcome.